Colleagues and friends, give me just 3 minutes to talk to you about ocular surface and dry eye, and it will change your clinical practice, as it has done my clinical practice. So think of the ocular surface as that very first layer, refractive layer of the eye. It's not the cornea, it's the tear layer. So that ocular surface is critical to all the refractive procedures we might do within a clinical practice. It's important in terms of a contact lens. It's even as important with regard to prescribing spectacles. Without that ocular surface being of great quality, we're going to get refractive surprises. We're going to get unexpected outcomes. So think as the ocular surface as being the primary surface with regard to refractive outcomes of your clinical practice. Now, 3 minutes is the time it takes to do a dry eye, an ocular surface workup. So within the time I'm talking to you, we could have actually done that ocular surface workup. And that workup for me is through the IDRA device, which gives us meibography, it gives interferometry, it gives tear meniscus height and other techniques and technologies that actually not only informs me of the diagnosis in terms of the cause of the dry eye, but more importantly, or perhaps as importantly, it actually helps me inform my patients what the condition is, and it really validates their symptoms, and then we're getting better solving of their issues, and also they're getting better compliance with the treatments which we undertake because they know what the problem is. So we're looking specifically at meibography. For me, that's one of the fundamental tests in terms of dry eye disease. I don't just want the expression of the glands that gives us the indication of the quality of the meibum, that lubricating layer of the tear surface, but I want to look at it not only in 2D, I want to image the meibomium glands so that I can see the percentage of meibomium glands drop out to inform the patients, and then really do everything I can to treat that underlying condition. We know that 80% of all dry eye has the major component as being a lipid issue, that evaporative dry eye. So we really need to do that accurate analysis so we can create a treatment that is targeted for that individual patient. So I want to just say thank you very much for listening for 3 minutes, but do look at technology that gives you that full platform of diagnostic suite of treatment, of analysis and diagnosis so that we can treat effectively. Only then can we get really good outcomes from our patients.